Hey, everybody. It is unbelievable that we're coming to the end of the second month of the year. And, February seems to have come and gone. It's been a month filled with a number of changes, certainly at the top leadership post in the agency, as well as the regional level. And as probably most of you know, for us here in Western Michigan, we do have a new BSC3 director. That's my direct supervisor, Ms. Danielle Martin, and she succeeded Kathy Miller, who retired. And we are also seeing a lot of different changes in our community. Certainly, the rollout of the COVID-19 vaccine clinics seems to be picking up, as well as other available choices via some pharmacies in the area. So, if you have recently been following up the updates from the health department, you know that just this last week there was an opportunity for DHS workers to take advantage of scheduling a vaccine at the clinic, virtually next door to our office. And I know that some people took advantage of that, and I hope that you keep your interest up on that front, and also try, if you are interested, to look at other options such as pharmacies and other community clinics. It appears that for most people, they are able, as DHHS employees, to either take advantage of the vaccination in the county they work, and if they happen to live in a different county, also in the county that they live. With our assistance payments front, we are very, very close to making the announcement on the staff that we've been able to hire. As you know, we've been completing interviews and we've looked at all the candidates. We have a pretty good final idea on who will be appointed, and we hope to announce that just before their start date, which should be coming up here in the next few days. Also, we recently completed the Food Assistance Management Evaluation. We call it by the acronym FAME. And that review is almost concluded. There is just a few corrections to be done. Our exit conference with the analyst, Ione Brown, revealed that we do have some strength in our system. There are, however, areas to make improvements. And we will be communicating with you the findings in due time, as well as engage many of you in coming up with a corrective action plan, which will be due within 30 days. In children's services, we've also continued to make some hiring decisions, and we've done interviews. We will soon announce a new foster care worker starting here in the next few days. So we are pleased to be able to bring help in and continue to fill the spots. We also, in children's services, finished our child placing agency audit, which is a fairly major event that we go through every year. The auditor review a substantial number of cases and processes, and granted that 2020 was a year of many challenges where field contacts and other things were limited due to COVID-19 restrictions and stay-at-home orders. She was nonetheless very complimentary of the staff work and the engagement that she saw demonstrated in our service to children and families. She also got excellent feedback from our foster parents, our caregivers of the children that we have in foster care, who were as well very complimentary of the support that the agency provides. This is a huge thing for us, and although we do have a few items, a few findings that we will have to write a corrective action plan for, we are very, very pleased overall with the results of this audit. One area that we are looking forward to in 2021 to increase compliance is with the timely scheduling of mentals and medical and dentals for our children in foster care. This was a significant challenge during 2020, And I know that there were considerable disruptions having to do with inability of folks to schedule appointments. Some providers were not seeing people in person for a while. But now that most providers are accepting in-person appointments, we are hopeful that our focus on getting our kids to their medical appointments, to their dental appointments, and periodic exams, as well as mental health assessments, were age appropriate, could be done in a more regular basis, and that the required documentation and proof is obtained quickly and reflected in the system. As we are always changing gears and having new challenges, I think it is still paramount that as we do this work, you continue to stay healthy, make good choices, and have a well-defined strategy for your self-care. We know that working remote and not having our regular interactions as a team has an isolating effect for many of us. But we also know that there is ample evidence that the stress of this kind of work, especially for those of you who have to face fairly tragic, traumatic situation, can lead to secondary trauma and compassion fatigue. There is, however, ample evidence that professionals who are resilient are those that are typically committed to an individual self-care plan. And so I encourage you to make sure that you have well delineated plans to make sure that you have a good transition from work to home life, that you are scheduling appropriate time off, that you are disconnecting from work when you are not going to be in service, and that you take care of your health. Remember that you have some good folks in the office, your peer review team. People are very resourceful, and they have a lot of good ideas, as well as they can lend an ear if you need to work through something, and you can use a shoulder to lean on, and they certainly can relate to what you're going through as they themselves do this kind of work. I don't want to leave this message without making again mention of the great activities and events that we experience in this month of February. I think that for us that do challenging work and are always looking where to get the strength to continue to do this very difficult work, the month of February, when we commemorate the struggle, the advances of our Black and brown sisters, can serve as an inspiration to us all. We know that we're nowhere near to where we need to be, but we can draw tremendous inspiration, having contemplated the tremendous sacrifices and the steadfast moving of so many who gave us a great example of bravery and drive, and many who still today continue to fight in the front lines to eradicate racism at all levels. I certainly draw a lot of energy from that, and I'm proud that we have that great heritage, and that we can recommit our work and using that model continue to improve social and racial justice in our communities, in our county, our state and nation. So I hope you're doing well. We are continuing our reporting of return to work screenings. We think that may be the preamble to some sort of partial return to work at some point. When those plans or dates become available, we will be sure to share with you. I wish that you have a great spring, hopefully coming up soon after this frigid winter. And I will talk to you soon or see you in one of our team meetings. Take care.